All right, guys, I think I'm live. I'm not sure if I am or not. Ryan, you have to come tell me if I'm live. Am I doing anything here? Am I talking to myself? Dun, 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 dun. Dun, 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 dun. Star Wars, nothing but Bar Wars. Hey, Heather Rogers has joined. Hi, Heather. How are you? All right, guys. So we're going to talk a little bit about the 24-hour UA. And this is geared for you guys that were not able to attend the seminar that we did with Jason in his symposium. This is also geared towards docs that did attend that might have questions or concerns or comments or something like that. So if you have a question, shoot them at me here. Do your thing. I'll do the best I can to read this. And we're going to go through and discuss the reason why I like doing a 24-hour year analysis. We're going to discuss the significance of it and what it can do for your practice. And we're going to do this in a short window, so we're looking at about a 25-minute window here where I'm not going to be able to do the whole presentation that I did for you in St. Louis. But I hope I'm going to introduce some things to you. I'm going more the rustic look today, if you guys notice this. That's called vacation. But this should be a lot of fun. So I hope you see it. I see Allie's here with us, which is awesome. Make sure you check in with us so I know who's here and who's not. And then we're going to kind of go through this. Now, the reason I run a 24-hour year analysis in my practice is that I found over the years of doing this, and I'm 20 years into practice, I found that probably 10 out of every 100 people that will walk through my door have some type of pathology. So we look at that and we start thinking to ourselves, all right, if 10 out of 100 have a pathology, now what does that mean, right? They could be diabetic, they could have a kidney problem, they could have any kind of a diagnosable disease. If 10 out of 100 have that and you don't look, then you can miss them. And I'll give you an example. We had a patient come in that wanted to lose weight, right? And we're talking about Chirothin now and how it ties to this. So we had a patient that wanted to lose weight. They came into the office. They're saying, hey, I've been struggling. I've been fighting. Can't get my weight off. Can't seem to fix this. What can I do? I've tried other diet plans. I've tried this, tried that. I said, well, let's run a urine first. I'll help you lose your weight, but I want to run a 24-hour UA. And so I started there. And when I ran the urine on them, immediately I noticed, hey, you got 1,000 glucose spilling over into your urine. Now, this patient had been to their medical doctor. They'd been to a couple dietitians. They'd been to other doctors, other practitioners. And what was interesting about it is nobody looked. Not one. Not one person looked. They didn't need to lose weight as far as body fat. They were swollen and retaining fluid. And their body was full of edema. All right, so we cleaned that up first. And then look to see, hey, what was left before we put them into our weight loss program. Now, the weight loss program is a great idea for them, right? Because why? It's a balanced diet. It's proteins, carbohydrates, and a little bit of vegetables and fruit. We're pulling the fat out of there. It's anti-inflammatory. So it has a huge advantage for them that way. So it's going to balance their diet anyway. But the urine told me, hey, you have a fire that no one's looked for. And the reason this person can't lose the weight right now is because they're struggling with all this fluid buildup. And they're diabetic. Nobody knew it. Sometimes it's easy things like that you don't expect. It's things like that, man, if you just ran a dipstick in your office, you would catch these. And so over the years of doing this clinically, what I've noticed and what I've found is that about 10 out of every 100 that walk through your door are going to have a pathology. Well, now we're thinking about weight loss, right? And all the people we see and all the people we want to help, and we think to ourselves, gosh, if 10 out of every 100 that walk through that door are having trouble with that, wouldn't it be nice to find that before you jump in the deep water with them? Wouldn't it be nice to know that ahead of time? That's what we're looking at. Hi, Brenda. So we go through this and we say to ourselves, okay, if this is the case, and this is where we're starting, this is why I like to run the urine. Now, when we did our presentation in St. Louis, I broke the urine down and I went through it. And Jason and I have talked a little bit. You guys aren't going to sit here for 2-3 hours, while we do this. It's too much. It's too hard. So what we are going to do is I'm going to break it into segments. And I'm going to try and do little webinars for you that will go through why it works and how it works and all the things we can get out of it. But I'm going to kind of overview it today and the importance of it. And the first one is right there. It's obvious, right? Rule out pathology. You now have a clinical test that is valid that rules out pathology. And so let's have a little fun with this. What color is urine before it becomes urine? You ever think about that? You ever go through your head and think, man, all right, it's yellow. What color is urine before it becomes urine? A friend of mine once told me that urine is just a yellow blood test. You can't beat that. It's a yellow blood test. That's what it is, guys. It's measuring how the body's trying to maintain homeostasis. So if we run a simple 24-hour UA, we're looking at what the body's throwing it away, right? What's it getting rid of? Because after all, isn't it the blood that filters through the livers, that goes out to the kidney, that gets concentrated into urine, and out you push it? And the color of that blood, you've seen it before, that coffee-colored urine, there's blood in there, right? The body didn't filter it well enough. It didn't get it out. So when we look at this and we start thinking to ourselves, gosh, what an amazing test. It's something that the body dumps every day, multiple times a day. So it's a very, very accurate measure of what's going on right now. Now, I've talked before about different university studies and things that, really for the last 150 years, we've measured 50 chemicals in urine. And 2-3 years ago, they decided, hey, let's do a little more looking. Let's get a mass spec, start digging into the urine, see what's really there. And we found that, oh my God, urine's got 3,000 plus chemicals in it. It's telling you what the body can hold and what it has to throw away. It's showing you where it's being pushed too hard. And it's giving you a very, very accurate indicator of what's going on inside. So I like to use the 24-hour UA in my practice with all my weight loss patients. It's a gold standard for me because it allows me to predict where fires are. Where are things coming on the horizon? Where am I going to see issues? Where is this body trying to compensate to maintain homeostasis, but it can't? It's struggling. It's saying, look, I can't do this, but it's going to show me. Now, the big argument always is, well, what about blood work, right? We always talk about blood work. And you've heard me say this before. Blood work is a damage assessment. It tells you what's already broken. So it's not saying run and hide, here comes the tornado. It's saying the tornado hit the trailer park over on this side of town and it wiped out these 3 houses in Walmart. Urine is saying run, hide, here comes the problem. It's not a disease yet, it's in trouble. Now, why is that important to us? Well, if you're helping people with weight loss and they're struggling, and you notice, you've all been, I've watched the feeds that we're doing now on the Chirothin page, and I say, hey, what do you do about constipation? What do you do about high blood pressure? What do you do? The urine's going to tell you all these things. It's going to give you a very solid, valid look into how that body's holding on to things and throwing them away again. And we look, I saw a thing a while back. It was on birds on the East Coast, Vermont, Maine, somebody up in there, and they were discussing how these birds live in the cliffs, and they were looking at the egg and the shell of the egg. Because, see, that body gets rid of things, whether it's a bird or us. Anywhere the body thinks, man, I can dump this and get it out of me, it's going to put it. Well, it just so happened when they started looking at these shells, they found all the things they expected to find, all the calcium and the minerals and things in the shell. But then they started finding environmental pollutants. They found hormones that would be in the environment. They found estrogen-based type products. They found petroleums. They found a cup of coffee. They just found it my way. Thank you. They found all these things that were going on inside there that they didn't expect to find. We've all heard about the biphosphonates, right, coming out of the plastics and leaching into the system. Where do you think they test for those? Go back to that urine, guys. You can test hormones. You can test blood. You can test a number of different things through the urine. It's a wonderful, wonderful way of telling where the body's in trouble and where it's not. So what I like to do then when I'm working with people and I'm going to work with the 24-hour UA, I like to know when you come into my practice, and I'm going to help you, Mrs. Smith, you're going to lose your weight. I know you got 105 pounds here to lose. I like to know that. I like to know why we have that. And so then we go through and say, all right, they come in, they're struggling with weight, they battle problems, we run the 24-hour UA. And I can look through it, and all of a sudden I notice, man, when they did that, they're not breaking down their fats very well. Well, I'm getting ready to put them into a program that's going to require them to tap into body fat and break it down. And gosh, their gravity's off, their volume's really low, and we'll go through what these mean later. Their volume's really low, their gravity's off, so we go look at this and we start thinking to ourselves, well, if that's the case, then they can't eliminate their waste. So this is someone, when I start breaking down their fat for them and helping the body to get rid of that abdominal fat and all the things that are stored in those fats, they're going back into circulation. Well, now the body has to detox. I saw Dr. Hankinson put on the other day on there a little rash that someone had up on their neck area. And he thought, my gosh, is this a reaction? Is it a detox? You know what I mean? That's what we're talking about. What if you had the urine in front of you and you literally could sit there with the urine, just like this, and you're going through it and you're saying, oh man, oh wow, they're going to struggle breaking that fat down. And man, those kidneys are not cleaning them very well. We're going to have to make sure that we pay attention to this. We're going to have to make sure they're getting adequate water in there. We're going to have to make sure that maybe they're breaking their food down better. And Dr. Strothide and I are start working together on some things for you guys to be able to give to them. Things that you can just, hey, use this, use that, to help balance some of the stuff we see on the lab here. We all see constipation, don't we? Isn't that like the thing you see all the time? It's always on there. So we look at that and think, well, gosh, what if we could predict that? What if you knew before they ever even started, they've loaded up over the weekend, oh, this one's going to be a constipation problem. It's easy, right? And that's what's so cool about this. You're taking a test that's valid, that has really phenomenal information it's going to share with you. And you're able to use this now and go that next step. So when I look at the UA, and I'm going to kind of give you some general ideas about this, because again, we can't go through the whole thing today, but we're going to give you some general ideas. I like to look at the pH. I think it's one of the most important things when you're looking at it, but it has to be a 24-hour pH. The little mouth test, the quick little dips of the urine, we don't even run the dips in our practice during the lab. We have a pH meter. The dips are highly inaccurate, and a one-time sample is junk. You have to have the full 24 hours, because what you're looking for is what is the price that body is currently paying to stay normal, to stay in homeostasis. So when we look at that, we think, okay, well, the diet. We put them on the diet. Guys, it's a stress. That's partly why you see people having bowel issues and things like that. It's a little bit of a stress, but it's a stress that's beneficial. In the big picture, the big scheme of things, this little stress, like lifting weights, is going to help the body to get stronger and better over time, but it still is a stress. So you want to see when people go on the diet and they start out, you want them to load up a bunch, run the urine while they load, and see, all right, when you're mean to yourself, how much does your body push back? How hard does it push back, and where? Then you look at the pH, and we'll go through this more. You all know about acid and alkaline and bases and things of that nature. When you're looking at the pH, let's make it real simple. When we're a little too acidic, okay, your body's not able to produce adequate amounts of bicarbonate, not in the stomach, further down in the small intestine. Well, that means, all right, all the enzymes that the body makes, they all work in pHs that are a little more toward the alkaline direction, especially when you get down to that small intestine. So you say, well, if I'm real acidic, then I may not make the bicarbonate that occurs, and all of a sudden I'm going to get this undigested food particles sitting in my gut. Now, why is that important to you as a doctor? Because if those things are rotting in that gut, then you're going to get what they call an autointoxication. Autointoxication, guys, is autoimmune disorders. All of your fibromyalgia patients, all of your lupus patients, all of your celiac, your IBS, your colitis, your Crohn's, your RAs, what else can I throw in there, that you can think of, all right, they start in that gut. So if we know this ahead of time, when we start putting them on a program that takes the sugar out of the diet, it helps them put balance of protein, carbs, fat, it's all balanced as we go through this. And when we get into the end of the program, when you put them into more of a maintenance protocol, you now know this is where their body's struggling. So it gives you a way of kind of seeing where the road is leading and what trouble you're going to get into. What's that, hun?
There's a sizzle factor for the
Oh, sure. Yeah. I mean, the wow. I mean, Rebecca's here. Say hi. Oh, you got to stick your head in here. There's a wow factor, right? We all know that. Wasn't that pleasant? Yeah, you know, one of the things, and she brought this up, that when I'm sitting with a patient, I can sit down with them because there's a million people trying to do weight loss, right? It's everywhere. I mean, it's a dime a dozen, but there aren't a million that do it well. And that's the ticket to this. You want to rock star this. You want to do it well. And if you do it well and you've got something that validates what you're doing, guys, I can sit with any patient. I don't care what's wrong with them. And I can flat out tell them, this is where the fire is. Here's what's going on. We're going to help you lose weight. We're going to help that body detoxify gently. We're going to help you get all this out of your frame. And at the end of that, I want to see how you're still feeling. And then I'll use my urine test pre and post to kind of get an idea of where we're going next. What's next, right? Because that's the end of this. You want to help people out. You want to help them above and beyond weight loss. You know, we've got several going through. You saw Heather in my office. She'll probably be posting today. You saw her and her journey that she's doing right now. There's more to that than just, hey, I got a little bit of weight going on, right? I've got to help this person get their life back. And if we don't do this as physicians, who's going to? Who's going to help them? I mean, you guys have seen the medical world out there. You've seen what they do, right? It's alarming at times. It's scary. In my practice, I use this child's ball. It's the shape sorter that little kids have. And when you do the child's little shape sorter, I write on the circle that this is what medicine has to offer. They've got this. Man, they rock star the circle. If you walk into the doctor's practice and say, Doc, I got this, and it's the circle, into the ball it goes, and it's a home run. But on the one I have, there are 13 other shapes. And medicine has the circle. Guess what? We have a whole bunch of the rest. So when I dig into that bag of tricks, Mrs. Smith, if you walk into my practice with a triangle, I'm not going to pound the circle into the triangle spot. I'm going to grab the triangle and put it in there. The ChiroThin program and what we're trying to do with this is getting you guys a base. It's getting you a starting point. Dr. Slocum and I were chit-chatting. You know, he runs a very structure-based protocol, very structure-based practice. And so we look at that and think, gosh, if he can help people lose weight, that takes care of some of the nutrition. And now his traditional chiropractic model all of a sudden is even better. It works even better. And some of you are much more broad-based. Some of you are like, man, I want to know about vitamins and minerals and enzymes and all these things. Well, now we've got that too. But you have to start somewhere. And that's what the 24-hour urine does for you. It allows you a starting point. You know, when we go back to our pH, you know, when you're too alkaline, think about it. You're too alkaline. All right, so what's going to happen then? You're not going to produce the stomach acid you need because the body's not about to give that up, right? Because when you make all these things for digestive purposes, they come out of your blood. Everything has to be borrowed. You borrow hydrogens, you borrow chlorides, you borrow all these things from your blood. If the body can't get what it needs out of the blood, it's not going to give it up. It's like, look, the blood is maintaining that pH. You can take a really sick person, run them into your office, draw their blood, and check their pH. What do you think it's going to be? 7.4. Until they're dying, it's going to be 7.4. So you look at that, then you think to yourself, well, Jesus, if that never changes, what is changing inside? They got all these symptoms. They have all these problems going on. That's what's happening. So the goal of this is to say, well, what if we have a way of measuring how the body's responding to all those stresses on the blood? And I like that concept that urine's just a yellow blood test. It is. It's just another way of looking at it, but you can look at it right now. So one of the other things I like to see on the urine is the volume and the specific gravity. So I focus on pH a lot, and I focus on the volume and the gravity. And again, the reason why is because the volume and gravity tells you what are those kidneys doing. How are they filtering? How are they getting rid of stuff, right? The pH tells me what price is the body paying to stay normal. And then the volume gravity is telling me what are those kidneys doing. So we look at that and we think, okay, so now we know the kidneys are getting pushed too hard, they're not eliminating waste, they're having problems. Let's think about that, guys. You're going through and you're looking at a patient. Mrs. Smith comes in. She's got chronic low back pain. You can't seem to get rid of it. You're working on her with weight loss now, and you know, man, if I can relieve that weight, it's going to take stress off the body. It's going to pull it off the joints and the weight-bearing joints, right? Knees, ankles, hips, sacroiliac joints, and the bottom 2 lumbar vertebrae. We know for sure those are the weight-bearing joints of the body. You go dumping weight off that frame, that's going to help that. But man, they're still hurting. They still got a little problem in there, and you've adjusted, you've done everything right. You look at your 24-hour unit, oh wow, their volume's 800. They're dehydrated. The kidneys aren't cleaning them properly. It's going to force muscle contraction to occur then. Where? Where the kidneys innervate. So you start looking at that. This is where you're tying in your anatomy. This is where you're tying in all the things you guys know back to your weight loss program. You're tying it back into the urine, and now you're validating what you do. So it gives you this wonderful, wonderful tool and ideas and things that you can do from there. So we look at the kidneys and things of that nature. Now, something else that I'll share a story with you that happened to me that was unique this last couple weeks. Kidneys are the organ of fear in Chinese medicine. So if you're afraid, if you have a terror in your life, the Chinese believe that the organs tie to different emotions. And I had this young lady sitting there, and she's gone through her practice, and she's 230, 240 is where she started. So you know she needs to lose weight. I've done the UA, I've done all these things. She's 2 weeks in. She's down 6 pounds. And I'm thinking to myself, you're 240 and you're down 6 pounds. Something's not right. Something's off with this particular patient. So I start going through her history, and I look at her urine, and I look at all the things, and I noticed the kidney was a little struggling. And I thought, fear, Now, I don't know what you guys do, and I do a lot of different unique things in my practice. Emotions are one of the things I tinker with. And I said, you don't mind if we play with this a little bit, do you? She goes, no, go ahead. So I started doing some of the emotional work that we do. Comes back next week, she's down 6 more pounds. Comes back the week after that, she's down 22. So you just never know, right? I always say, stress is the cause of all disease. Men are the cause of all stress, right? It's that little triangle that we make. We've got a mechanical side, we have a nutritional side, and we have an emotional side. That's what you're looking at right there. Well, the mechanical and the nutritional we're doing. That's what the weight loss program's doing for us. It's balancing all that. And I'm adjusting and doing all the things I should do. Something was holding it up. And all I had to do was find that emotion. When we let that go, and it was just a matter of her talking about it. Something that happened when she was a child. Something with her mom being involved in her life and feeding her all the time when she was stressed. And she's a stress eater, right? Food is social and emotional. So all of a sudden, when we freed that up, bang, it got it. But I would have never known to look had I not seen that volume and that gravity off. When I saw that on the 24-hour UA, I was like, oh, I bet there's something going on with the kidney. See, there's all these cool things you can do. It's just a matter of how far you want to take this stuff. So the way I do this in practice, because I've had a lot of people ask me about this, is, Doc, how do you run these? When do you run these? And so on. And I've changed things up off and on over time to look for the best. I always run it pre. Always pre. I try to run it before we start. I want to see when they're loading, how hard is their everyday diet that they've been living on for the past decade, how hard is that on that body? So I can kind of look for potential problems and flags and things of that nature. I then like to run it after they finish. Now, it depends on how you do the program. If it's the 6 weeks only, I like to wait until after they've maintenance, they've stabilized, they've gone back to a normal routine, but it's different than when they started, right? The maintenance program is different. I go back to that and I run it again. And when I run it on the front end and the back end, like bookends, when you run it on both, it gives me a really good idea. It's telling me, okay, where was the body starting? What price was it paying? And now I've made all these changes. And after I've made all these changes, I like to know what's going on now in the body. Where's the body saying, look, this is where I'm now being stressed. And then what that does for you, it allows me to take that group of patients and say, well, Mrs. Smith, you're going to need more care now. Your weight's good. We got you balanced there. But you still have this thing going on. You still got your blood pressure issue. Maybe you still have your IBS. Maybe you still have arthritis pain or something of that nature. Here's what the urine's telling us. And that's when I recruit them into practice. Dr. Naputi, a good friend of mine, did a talk last night, and he invited me down for it, but I'm in Florida right now with my family, and I wasn't able to attend. And Eric and I were talking afterwards, and rock star. The guy does phenomenal talks. And we were discussing it, because when we do it together, When he comes up for my talk, so I come down for his, our close rate is ridiculous. It's outstanding. You know, guys, it's nothing to do a $50,000 night. You know, it's nothing to do that. And we're talking a half hour, 45-minute talk is what we usually do. But the key to it is understanding the program. And then you recruit those patients in. And in Dr. Naputi's expertise, he's so good that once they're in, how to get those patients to come back around and become long-term patients. He uses the 24-hour UA. It's one of the, Eric and I have been working together for years, and it's one of the things he does. He knows the value of it. He sees the value of it. And you're looking at an inexpensive test that will tell you more about your patients than anything else you can do. It really is phenomenal.
$65.
Yeah, okay. So a couple things are happening. You guys, we sent out a bunch of kits for you guys. We're waiting right now. I'm not going to put this company out there yet. I will in the future if they give me a hard time. But we're waiting on this company to finish our webpage. It's 99.9% done. Our stuff's been done for a month. When they get it to us, and they're telling us now, it was supposed to have been yesterday, they're telling us now maybe Monday, we're going to run a bunch of dry samples through there. I'm going to run a whole bunch of UAs through it. I have to make sure that the reports that you guys are going to get are going to be all-inclusive. They have to be able to, you can look at this and say, oh, wow, I got to look for boom, boom, boom. The interpretation page. You're going to get a report that's going to look very similar to this. It'll almost look exactly like this. That's a standard UA in our office. But you're going to get a second page. The second page is going to connect all the dots. So it's going to tell you, this is what it is, this is how it works, this is why we do this. I want to make sure that you guys don't have to have 20 years of understanding digestion and enzyme work and all these things to be able to get by on this. It's got to be paint by numbers and very simple. And that's the idea of what we're doing with this. So as we work forward through this should be up. I'm hoping. They told me May 1st. I'm not sure. We'll see. But we're going to run a bunch of dry tests this week. As we go through these tests with us, and I'm going to run a bunch of dry ones. We're going to run every possible combination I can think of. We'll then get those out to you guys. That's why I had you run your own first. Run your urine. That's why we gave everyone kits. Run yours, then we can go through it, and you should get an explanation and an example. I want to make sure it's going to be super, super simple. So we had a question here. How much do you charge patients for the pre and post? I'm $150 for my pre. I charge $150 for my pre. I charge $100 for every follow-up I do after that. Now, that's not including the consult to read it and things like that. That's just the urine itself. So that's how I do it in my practice. The cost to you guys is $65, and that's the running of the test. That's the report you'll get back. Insurance, we're looking into this because I run a cash practice. I always have. I don't do any insurance. Heather, who runs the lab, she worked at, let me get my brain working here. She worked for the hospital in town that I'm in, and she was their lab director. And she's gone through and found several different codes that you can use, billing codes that you can use. And the codes are, I think she's got 3 of them right now. We're looking at roughly $160 to $180 is what we're seeing. So it'll cover the cost of the urine for sure. Possibly have a little more on the back end for you. But the key to this thing is that we're trying to get this as seamless as possible. You know, and Jason just noted up here that we're working on putting some paint by numbers supplementing for this. Guys, we are. And there's certain things he already has that will work. You know, there are core things you're going to see in the urine that have to be corrected. You got to look for yeast. So you're looking at a probiotic in some way to rebalance the gut. You got to look at something to help break down digestion. You have to look at something to help the body clean and eliminate. Those are the 3 core things that when you look at this urine that you want to focus on. And again, the more you want to do, the more we'll explain, the more we'll go through this. You know, when Jason approached me about doing this with you guys, because there's a select group of the doctors that want to know the ins and outs, that want to know the why and how and all the little nitpicky things. But there's a whole other group that are like, you know, I just want to help people and I don't want to know all that stuff. So this is what we're trying to do. We're trying to cover the bases for everyone. And when I do my little webinars like this, I'm going to do real simple, just easy. I'll take a section of the UA and I'll explain things with it. And we'll do a series of these little half-hour kind of deals, and we'll go from there. Will's asking, do you always run the UA during the loading phase? I always do. Always. And here's the reason why. I want to see when they're bad to their body, what does their body do? How hard is their, because really the reality of it is, their loading phase, guys, is why they're in your office. That's how they are all the damn time, right? We know that when they're out and about, they're on vacation, they're drinking, they're on the boat during the summer, they're having a good time. There's nothing wrong with that. We just want to know how hard is it on that body to have that good time. So the best time is loading because you're giving them a get-out-of-jail-free card. You're saying, man, go. Collect your $200. Don't stop it. Go and keep going. Go. Get out there. Have fun. So we want to see it then. I then do it at the end after we've lost the weight and we've balanced that. Remember the set point? We've created that set point because during the set point, you're focusing on the new diet for them. We're focusing on the new lifestyle. Because that's really what this is. You know, Eric, when he was there, Becky, did a great job of telling you guys that, man, this is a new lifestyle for people. You're helping them regain their life. But at the same time, you're teaching them, look, it's okay. You can have your cookies, you can have your pina coladas, you can have a beer. You just have to know how often you can do it. And that's what we're using the urine for. The urine is kind of helping me say, all right, Mrs. Smith, when the body's stressed every day. Every single day. There's never a day it's not stressed. We're just trying to say, all right, where? Where is it being stressed at? Where is it being pushed too hard? And once we know that, then we say, hey, Mrs. Smith, you know, you did rock star great. You lost your weight. I know you're feeling better. But look, your body's really having some trouble with that gallbladder liver area. You're not breaking your protein down that well. We got to help you. And that's what Jason's doing. He's putting together a couple of these things that are going to help them with that. And then it's just really a matter of time, guys. You don't have to do everything. We're not drugs, right? And this is a big flaw in our thinking model, I think, that especially the way they teach at the universities, is that, oh, we're going to use vitamins like we do drugs. We're going to put a bunch of this in and we should need to see the result tomorrow. Nutrition doesn't work that way. Nutrition is the tortoise and the hare. Slow and steady wins the race. And as you start doing this and people start getting better over time, and you watch them improve and you can see their health and now you can track it. You have a way of validating it. You can show it to them. As you watch this occurring, all of a sudden they're like, holy crap, my doctor knows his shit. He knows what's going on, or she. They know what's going on. They know how to do this. That's the idea for this thing. That's what you're trying to achieve. And by doing it this way,
an authority in the community.
you're it. You are it. You are the authority. I mean, you can't enter my town, okay? There's not a chiropractor in town. We probably have 150. I'm at 120,000 people. We probably have 150 chiropractors in town. I couldn't name 4 of them. I'll guarantee all 150 know who I am. I'll also guarantee every hospital and every doctor in town knows who I am. That's how I wanted to position myself. I wanted to position myself as the authority.
And they don't call and challenge you.
There you go. Yeah, and Rebecca's telling me I have a radio show. I've done one now every Saturday for 18 years. Okay, I don't get calls challenging me on what I say. It never happens. Nobody steps up to the plate because I'll knock them back down. Right? Know what you know what you don't know. And the urine gives you a way of understanding things that nobody else knows. And it's going to, like I said, for me, it's a recruiting tool. Let's see what else we got here. So the UA will tell us yes, during or after the 40 days or both. During the 40 days, you can do it. Yes, it's both. This is Lee. It's both, Lee. It'll help you understand, do I need to put things in? Right? Because sometimes you'll see, like in the Chirothin stuff, it'll say, hey, we might need to use supplements. We might need to use, electrolytes or something of that nature. If they're cramping and things like that, you got to put electrolytes in. The urine's going to find all of that. It's going to find it when they load. So you're going to know that. And then afterwards, especially when you run the post-UA, that's going to show you, all right, what didn't correct? What didn't get better? After we did all of our weight loss, they got their weight off, they're feeling good, but there's still that little couple, 2-3 things you got to work on. It's going to show you what needs to be done next. And it's really phenomenal. Let's see here. Does the patient send in their own urine to the lab, or do you?
Through the doctor.
I prefer it through the doctor. And the reason I do is because once you guys set this up, you know what's coming, you know when it's in, you know when it's... We've had trouble in the past when we tried it the other way. We try to do it through patients on their own.
Come and pick up at your office.
And the problem that they do is that patients are funny. Well, I send it on Monday, I send it on Tuesday, I send it on Wednesday, and it's sitting in the refrigerator. You know how it is, right? It's the same thing with appointments. Oh, I forgot I had one. Yeah, okay. So it's easier if they just bring it back to the doctor, and it goes out through the FedEx, comes right to you guys. They'll pick it up.
Every day.
and go. You don't have to do anything. You don't have to leave your office. FedEx will come and get it from you. So it's let's see here. Okay, lots of urine in 24-hour period. It can be. And we send out a collection container. We had it at the symposium. The collection container will hold about 3,600 milliliters, which is a gallon. It'll hold a gallon. You every now and then will get someone that'll go over that, but not very often. Most of the time you're going to see unders versus overs. So you don't see a whole lot of people dumping in 4 and 5 and 6,000 milliliters of urine. You see a lot of 800 to 1,200 to 1,600. That's very, very common. Now, we don't need all of that. We only need that much. You're looking roughly about a half a cup total of urine, and it'll come in. I don't have a kit with me. Sorry. You'll get a kit. It'll be a little box that we ship. It'll have a freezer pack in it, and it'll actually have a urine specimen cup. That's sealed. They'll break the seal when they open it. They'll put it in. They'll reseal it tightly. Drop it in there, it's zip-locked in, and they send it to us. So we only get that little bit, okay? So that little bit then is what we're after. And the goal of it is we can run all of our tests off of that. We need the full 24 hours because I need to know that volume. Remember how I talked about volume on here being really important? pH, volume, gravity. Those are the 3 core things on that urine. So we got to know that volume. We just have to know for them. We also, Heather's noting here that we have hats for women, because sometimes it's hard to collect. So we've got these little hats we can send out if you have a lot of female clients, things like that. Rhonda, what are you asking? How long will it take? How long will the UA hold? A long time. Urine is more stable than what you think. We got one from Canada a while back in the lab that we run, and it was shipped out. Something went wrong in customs or this or that. This had been several years ago. And it came, they mailed it in December. We got it in May. I thought, what the hell, I'll run it and see what happens. It was dead on. Dead on. And there's some tells. So one of the tells with urine is the pH. Again, we go back to that. If the pH is super erratic, really, really alkaline, super high, there's a good chance that the urine should be rerun. And the lab will flag that to you guys. We put it currently in this little box over here. It'll flag that and send it to you and say, hey, we need to rerun this urine. We don't charge you for the rerun. So it's just a free rerun, and we rerun it and see what shows up. If the pH continues to stay high, then we know there's medications that are doing that. But we'll send all that to you and let you know for things. They notate it. It's highlighted on there for the doctor so you have an idea. Let's see what else we've got here. How can I get a kit for myself? What's our address for the kits? How are we doing that right now?
info@mccaffreylaboratory.com.
Okay, info@mccaffreylaboratory.com. Heather will put this on here. She's saying right here, she's going to message you, Chris. Okay, Alan Terry, if they do go over a gallon, then you are not concerned because you know the volume is high. No, I do want to know, though. I still want to know. So what you'll do with someone like that is if they go over, yes, we can get away without it because we know that they're in polyuria, so it's not that big a deal. But it's nice to know because I had one the other day that she was 4,900 milliliters, which is a tremendous volume. And I said, man, do you drink a lot of water?
Without the jug.
And she didn't. She's coffee and tea. And I'm like, ooh, that's bad. Because it's not water contributing to that volume now. It's the other thing.
That is what they want to know.
I'll sometimes send them 2 if I have to, or if they spill over, if they collect over, I'll have them get a gallon jug, a distilled water jug. If they know that, man, I'm getting pretty close to the top and I'm halfway through my day, I'll have them get a gallon jug of distilled water, pour the water out, cap it, and leave it. And then what they can do is they can collect the remaining urine in that, and that'll give us a general idea of how much there
Get a
is.
scale together for them.
Yeah, and I think that there's a scale we've got set for all that, if that does it. Have you had cancer-free patients on the UA? Cancer-free, absolutely, all the time. How do you handle their treatment? When you're looking at cancer patients, people that have gone through that type of therapy, I saw one on here this morning, someone posted that they were a little afraid to do the UA, or to do the weight loss program. The Chirothin program, guys, when you're looking at the amino acids that are in the product, okay, we're not doing the hormone. And this is a key to this, okay? You're not doing the HCG. You're not doing that hormone. You're following the concept of the diet, within reason, and we tweaked a little bit over the years, but you're following that. But you're not doing the hormone. And this is something Jason and I talked about a long time ago about, man, we got to find another way other than the HCG because it is a cancer marker. And there's no doubt about it. It is a cancer marker. So the amino acid formula that has been put together, that's what the drops are, right? They're not the hormone. So you don't have that push on that system as much. Now, if you guys have seen some of my posts on here, maybe I'll do another one for you. Great research has been done now showing that intermittent fasting diets for helping people through chemotherapy, for helping people who have suffered from cancer or are actively battling cancer, have phenomenal results. Well, that's what you're doing. You're doing a 500 calorie a day diet or less, right? Intermittent fast. It has phenomenal results. So there's great research out there for that. Now, as far as the 24-hour UA goes, again, it's showing you where's the body putting up a fight. So if you have someone that's battling cancer currently, the urine test will tell you, look, it's the adrenals that are putting up the fight. It's the biliary system that are putting up the fight. Maybe it's the thyroid or it's the urinary system. You'll see that. And if you know that, then you know, all right, man, instead of chasing, immune function, I need to really be working on helping this body eliminate. I need to support that. And if I do that, now the body has the best chance it can to fight back successfully. If they've gone through chemotherapy or radiation, how much debris do you think that body's got? How much toxins are trapped in those stored fat cells? Tons. So the urine kind of gives you an idea of where to go. Where's the fight at? Let's see. I'm ready to get my UA kit. Very good. All right, guys. Do you have any other questions for me before I kick out of here and head to the beach? I'm talking to myself. Bueller? Anyone? Ferris? That dates me a little bit, but it was still funny when it happened. All right, I think we're in good shape then. So this is my first little webinar with you guys. I'm going to try and keep them short if I can. I know this one went a little long. I'll try to keep them short. I'll try to answer questions for you. If you guys have anything you need, get in touch with Heather. She's in the lab. She'll run this. Thanks for joining me today. I hope this is awesome for you guys. I cannot wait to see how excited you guys are going to be when you start rocking things out. I got one thyroid question here. Thyroid seems to be a big deal by itself. 24-hour UA health. Absolutely. You'll see a ton. Hypo and hyper on there. We're all good. All right, man. Guys, I'm off to the beach. See ya.